Who's awake? Who's suffering from jet lag and not awake yet? Who noticed the deliberate mistake? Okay. I originally wanted to talk about behavior change as a whole creature, and so the elephant became my metaphor. But I'm afraid yesterday I was so taken with the talks in the plenary that I changed my mind completely, going with the standard theme, Eddie. We don't follow instructions. We change our plans. So I'm afraid I've got rid of the elephant. And what I'm going to be talking about instead is this. Glass, right? This is where this comes from. Have a good look at it. It's not actually Clarissa's slide. I'm not blaming you for this, Clarissa, though you have a little bit of the blame, perhaps. What's wrong with that graph? Two things wrong with that graph. Two big things wrong with that graph. Where is hygiene? It's almost invisible. Good grief. That really shocked me yesterday. I didn't realize it was as bad as that. What else is wrong with that? What's this? Hygiene education. Didn't hygiene education go out with the ark? Why are we still talking about hygiene education? We should be talking about hygiene behavior change, hygiene promotion. We should be talking about, because this implies that education is the way to change behavior. Education is important, but I think we know a lot better than that now. So these are my two themes for today. One is about resources, and the second one is about how we actually go about changing hygiene. So I want to talk about resources for hygiene, and I want to talk about what we do if we don't do hygiene education. Why are we talking about needing resources for hygiene? I don't know how many of you in this room know this graph or know the work of the disease control priorities review that was done by the bank, by WHO, published by Oxford University Press in 2006. They reviewed the cost effectiveness of every intervention to improve disease control in developing countries. And when I first saw the graph, I rang up Sandy, my boss, Sandy Cancross, that many of you know, and said, "Oh my God, Sandy, this is terrible. Hygiene comes at the bottom of the graph." Sandy said, "Have a good look at it," because what it actually means is that hygiene is the most cost-effective intervention of all for preventing disease in developing countries. This is the short version of the graph. The original graph is bigger than will fit on a screen, and it reviews all of the different interventions, including all of the famous interventions for malaria, all of the famous interventions for HIV, including sanitation and water. But hygiene promotion comes out as getting you the most bang for your buck. So somehow, somewhere, we should be taking notice of this. If it was a rational world where we spent our money in the most cost-effective fashion, we'd be putting hygiene first, not last. Why are we doing that? We all know why. Diarrheal diseases. But do we all shout enough about this issue? It kills more young children than AIDS, malaria, and measles combined. Yet if you ask anybody working in public health what are the most important issues, they won't say diarrheal diseases. I'm not going to spend a lot of time in this forum going over the evidence as to why hygiene is so important. Eddie's only giving me 25 minutes, so I'm going to skip through it. But we know that one of the most important hygiene practices is hand washing with soap. We know that if everybody washed hands with soap, it would save in the order of 1 million lives a year. But it'll do a lot more for us from diarrheal diseases. But it'll do a lot more for us as well. It can prevent the epidemic infections that so concern governments, often far more than the endemic infections which kill far more kids. It can prevent respiratory infections. There's evidence that hand washing helped reduce the impact of SARS, and it was very important in the pandemic flu epidemic, that we had recently. New evidence suggests a 44% reduction in neonatal mortality associated with hand washing with soap. And as a result, we're getting more involved in hand washing around the neonatal event. Suggestion that hand washing with soap can help reduce malnutrition. A new hypothesis, TE, I don't know if you've heard of that, tropical enteropathy. The idea that most kids in poor conditions in developing countries are effectively bathing in a sea of shit. There's shit everywhere. There's animal shit, there's human shit. Sorry, I like to talk about shit a lot. I think it's very important that we talk about shit. If you remember, Eddie, when we, at the Iguazu conference, we decided we would award prizes for the people who could say shit most often in a presentation. So I'm up for the prize today. Malnutrition, tropical enteropathy, tropical enteropathy. The suggestion is that on average, children's IQ is maybe 5% lower than it should be because they're permanently immunologically challenged by living in an environment full of the microbes that come from human shit. So hand washing can help reduce that. So can sanitation, of course. And some evidence, for example, that people who are living with HIV/AIDS can also be protected by hand washing with soap. So I started thinking about what I'd like to see resources go to, what I'd like to see for a better world. And I thought I'd come up with my own set of MDGs. It's about time we've put hygiene into the MDGs. They're not there now. So every child in the world protected, in the same way almost every child is protected by vaccination. Hand washing with soap is a do-it-yourself vaccination. So I'd like the MDG to be every child lives in a home protected by hand washing with soap. I'd like every child living in an environment that is shit-free. That means safe disposal of stools, including children's stools, which is very important. Every child doesn't eat shit. Every child gets safe weaning food, safe foods that are not contaminated with the bacteria that come from shit. How many times is that? We're getting there. Every girl has the ability to deal with her menstrual flow in a dignified manner. She has the ability to do menstrual management. Every girl needs to be able to go to school and have a private place where she can change her menstrual bands during that period. At the moment, it's a matter of shock and shame that girls can't deal with this in a dignified manner. And that every school has, too many new acronyms. I've changed it around. Hygiene, sanitation, and water. How come we're living in a world where schools don't have that? Surely the simplest and easiest of things for us all to achieve would be that schools had decent sanitation, hygiene, and water. That must be easily achievable, even if everything else is more difficult. So, Alan, maybe you're going to spend $400 million building a bridge to Tasmania. But you've left something out. You've left out the last mile. You've left out hygiene. Because you don't get the benefit from your hygiene and water interventions if you don't deal with behavior. We have to deal with behavior change. So please, let's not pour our money into construction without thinking about how we're going to get where we need to get, which is people behaving in a safe fashion that prevents the transmission, the fecal-oral transmission of infection. So, second theme, how do we get behavior change? It's really difficult. Millions of mothers like this mother in developing countries living in difficult situations where the habit of hand washing with soap, for example, is just not there. How do we understand what she's doing? And then how do we get to programs on a large scale that can really change what she's doing? Behavior is difficult to change, but if we understand it better, maybe we can do something about it. This lady's washing her hands. What's making her wash her hands? Her brain, right? Her brain's driving her body, which is making her wash her hands. But of course, she can't do it without infrastructure. This is a rainwater tank that she has here and a basin that she has for collecting the water. And one thing that's very often forgotten in behavior change theory, which is that you actually need an object to change, to act with. And those objects can influence your behavior. And finally, another thing that's very much forgotten is that behavior doesn't take place in a vacuum, it takes place in a setting. Infrastructure is part of the setting, but I think if you can see a pair of feet there, this is a social setting as well. We all behave. Our behavior is dictated by the social setting in which we are. Now, I'm making absolutely no apology to have a little detour into theory. You're all practitioners. I'm an academic. I love theory. I wish you would love theory too. This is what Leonardo da Vinci said about theory. He said, he who loves practice without theory is like the sailor who boards a ship without a rudder and a compass and never knows where he may cast. How do we know where we're going? And more important, how do we know when we've got there if we don't have a little bit of theory? So let me unapologetically give you a little bit of theory of behavior change. What we've been doing with my colleague Robert Onger, who's here in the audience, we've been trying to pull together the best of what is known about behavior change theories. And this comes from health psychology, it comes from behavioral economics, it comes from the practices of behavior change from many, many different domains. And we've tried to pull them all together into one coherent framework. The framework's very simple. It's like what I just showed you. Behavior affects health. The brain affects behavior. Brains do not act in a vacuum. They act in response to the settings in which the brains are. We use objects, which are very important as part of behavior. If we're going to change behavior so as to change health, we need to change brains. To change brains, we need to change settings, and we need to design interventions that will change those settings. Now, how are we going to go about doing that? We need to work backwards to start with. We need to do backwards research, which is, first of all, to try and understand what's going on with behavior and health, trying to understand what's going on in brains and settings, from which we can draw all the insights that we need to actually design interventions. And of course, we have to test those interventions and then roll them out, whether they're on a mass, a community, or on a household scale. And of course, we're talking about programs here, so we have to talk about monitoring and evaluation. So that, if you like, is my whole elephant. It's trying to get the whole of the behavior change problem onto one page. And that's what we use to guide us so that we know where we're going and know where we've got to when we get there. So how many brains have you got? Each? Or one? Any advance on one? More? One brain each? Two? 2 brains? More? 3, yes. You've got 3 brains. You have an ancient reptilian brain in your brainstem that keeps you doing all the things that you're doing at the moment. You're not falling off your chairs, for example. You're all breathing. Many of you are touching your faces, or you're doing it all quite unconsciously, quite habitually, sitting there with your legs crossed, with your pen writing away, not thinking about what you're doing. That's your reptile brain at work. But how many of you are hungry? Yeah, me too. I'm hungry. It's my tea time back home. My mammalian brain is going, oh, about time I got a feed. About time I did something about sorting out. Oh my goodness, I'm embarrassed standing up here. My mammalian brain is saying, I want to run away, I'm scared. It's really scary standing up in front of lots of people speaking. It's all right, I'm not going to, well, maybe I will. That's our mammalian brain. A large part of it acts in response to social situations. And on top of that, I have a third brain. So do you all have a third brain, at least I hope you do. It's the brain that makes us human. It's the brain that allows us to imagine. It's the brain that allows us to plan the future and make long-term plans. So my favorite part of the brain is the middle part of the brain. It's that